All right, so good morning and welcome. This morning's topic is clinical supervision, or the essence of clinical supervision, because we have a limited time, but this is intended to give you an introduction to clinical supervision. And some of the things that we'll talk about are the differences between clinical supervision and administrative supervision. We'll talk about also a couple of different theories around supervision and some of the kind of competencies for supervisors as well. I'm Dr. Susan Thompson, and I've actually been providing LPC supervision since around 1998, 99. I was trying to figure out exactly when I started. I've been licensed since 96. I can't believe it's been that long. And I also, for 9 years, was the clinical coordinator at Old Dominion University. I taught advanced as well as introduction to supervision. So this is something that I love. And to the degree, this is a pun intended, my PhD is in counselor education and supervision. So I studied supervision when I was in my doc program, in addition to counseling theory and counseling skills. And I've been providing nonstop LPC supervision. So I currently have individual supervisees as well as group supervisees. I'm practical. I love practical applications. So we're going to do our best to make this as practical as possible. What I've highlighted are some of the supervision theories that I think are going to be most relevant to get you started. We'll talk about role induction, some of the basics of a supervision agreement, and some record keeping. Now, my warning is this, that I really have been focusing on licensed professional counselors. So I'm not as familiar with social work, and I'm not as familiar with psychology. However, there's a lot of overlap among the supervision theory and approaches. So please know that although that my focus may be more specifically toward licensed professional counselors or counselors, it really is broad. When I took a look at what the APA is suggesting for supervisors, that's one of the handouts that you have. The document that came with the summary there actually indicated that this task force that was working on that document referred to the counselor education and supervision recommendations for supervisors as well. So you have a handout on the Approved Clinical Supervisor Code of Ethics. And so let's really start with what is supervision. Supervision this is the definition that is shared over and over again in the literature. It's a process in which an experienced person, a supervisor, with appropriate training and experience, so it's the training and experience, mentors and teaches. So you're already starting to get into roles, a subordinate or supervisee. Another definition is that it's a process. So you got a theme going now here. It's a process of personal and professional development. So now we have a couple of areas of focus. It's not just professional development, it's personal development. That's the clinical part of clinical supervision, in which the supervisor challenges. Now we're getting into some of the tasks of a supervisor. Stimulates and encourages a counselor, a therapist, to reach higher levels of competence. Now we have the goals for supervision. The idea is that for clinical supervision especially, you're working toward developing the counselor so that they are increasing their competence in their work as a therapist. So, just to be really clear, we have two major kinds of supervision: administrative supervision and clinical supervision. And the vast majority of supervisors and organizations are tasked with administrative supervision. Administrative supervision is about management. It's about functioning, teaching the supervisee to function as a member of the organization. So there are even more specific tasks around that include documentation, case notes, really the specifics of how do you do your job. And the supervisor, then they're tasked again with more of the organizational accountability. So that's them teaching a supervisor the accountability in order to do their job, which would include making referrals and also completing performance evaluations, those evaluations that are implicit in making sure that people are doing what they are intended to be doing. In contrast, clinical supervision is about development. That's the process. So whether that's facilitating, teaching, training a supervisee to learn new ways of intervening, new therapeutic techniques, including assessment, case conceptualization, cultural awareness, and really developing the supervisee as a professional, which in the work that we do, you also have to develop the person. And so administrative supervision, if you're a really good administrative supervisor, you're going to do this. But sometimes there's a disconnect between administrative supervision and clinical supervision. Most administrators have never been trained in supervision. They get promoted because they're good at what they do as clinicians or whatever. And few organizations truly provide good training in management or supervision. So, status quo for counselors, therapists. Our jobs are more challenging, increasingly more complex. Our caseloads are growing. We are facing more and more ethical and legal challenges. I've also presented for school counselors. School counselors' roles are evolving too, and they're becoming more diffuse. I've provided supervision to people who are school counselors, folks who are doing in-home services, folks who are in residential treatment centers, folks who are in private practice. So a pretty wide variety of supervisees. And what I meant to say at the very beginning is I think that I'm a better counselor now because of being trained in supervision and being a supervisor. I have to be much more mindful of how I talk about what we do to my supervisees. Oh, that last point on here is that counseling skills tend to decline over time without supervision. So that's kind of makes sense. I think it makes sense. We tend to just keep doing what we've been doing, and we often don't learn and grow on our own. So here's what I want to ask you. It's a small group, and that's okay, but I'm asking you for some participation here. I'm going to ask you to get into groups of 3. You can do 2, that's okay. And on one side of the room, I'm going to have folks talk about what are supervisor qualities that facilitate supervision, and on the other side of the room, inhibit effective supervision. So this side of the room, I'm tasking you with talking about and coming up with a list of what helps supervision, the supervision process, and over here, what inhibits it, what keeps it from being successful. I'm sure many of you have had supervision that didn't go so well. I know I have. So we want to see and compare these 2 different kinds of qualities. So let's see here. So take just a couple of minutes. and I'm going to give you 2 minutes to have the discussion. So in groups of 2 or 3, talk amongst yourselves, and then come back and we'll share out. So remember, somebody could take notes so that you can record your discussion.